there, it's Dimitri from Total PT, and this is Eric from the Annex. We're in the Chatham facility today, and last time we went over how to screen for tight hip flexors as well as a tight anterior capsule. You could look at the previous video blog for those two tests. And today we're going to talk about stretching of those muscle groups as well as the anterior capsule and two different ways of doing it. So just to reiterate really quick, a positive Thomas test, if you lean back, one knee up, one knee down. What we're looking for is, again, just to reiterate, is to make sure that the leg is lower than the table. In this case, he's got a tight hip flexor because the Thomas test is positive, meaning that the knee is a little higher than it should be. It should be down here, his is up here. So we need to stretch out the anterior muscle groups, which are the hip flexors, as well as the capsule, which is in front of the joint itself, that handles that mobility. So coming up, Eric, and what we're going to do is, we're going to stretch out the right side. So you go into a kneeling position, just like so. And I want you to put both hands on the outside here. Yep. And what we're going to do, we're going to actually turn our bodies away from the hip to try to increase rotation, because when we're running or walking, we are turning away from that tight side. So when you stretch, you do want to incorporate trunk rotation to improve that mobility. So what he's going to do is he's going to translate his hips forward just a little bit so he feels a stretch in the front. It's almost going to be in the upper thigh. Feel that? There you go. Good. Now a lot of people, what they'll do is they'll kind of lunge out way forward like this, and what you're doing is you're basically just moving forward and not stretching anything, because the muscle itself originates in the front lateral aspect of the spine and attaches in the groin. So you want to keep the body vertical and translate that hip. And if you notice, he's not going to have to go far to feel that stretch. But if you look at the body is vertical with a slight rotation away. So this is the position you want to be in. You want to hold for about 20 to 30 seconds. And you could repeat 2-3 times and more if you feel it's necessary. And that's going to be the stretch for the hip flexion. The hip stretch for the anterior capsule has to have rotation of the hip itself. So, Eric, let's do two ways. Face this way, and you're going to put that right foot like so, and then you're going to square off. And I'll explain that a little bit. You may actually want to come this way. So here what you're going to do is the hip has to rotate externally. So the table here is actually going to block that hip from swinging back out. So as he rotates, let's come even closer. There you go. And now square off, face this way. There you go. So now that hip rotated externally to expose that anterior capsule. And then he's going to try to, it's not going to happen, but he's going to try to square up the hip and give himself a slight anterior translation again. And you should feel kind of a more gross kind of torque in that front hip. And that's going to be, and you can see by his face, that's going to give him that stretch of the capsule, not necessarily the muscle. I mean, the muscles are going to stretch too, but that rotation isolates the anterior capsule. That's one way to stretch it, and you can hold this for about 15 seconds, ease off, and do it again. There you go. And then the only difference between the other stretch is here, the hips rotated externally to isolate the anterior capsule. The other stretch that mimics this somewhat, and you can do it right here, what Lauren did before, and I'll go through it. So go down on your stomach, and what you're going to do is you're going to go on your forearms, cross your legs, knees out. There you go. And pick yourself up a little bit, and then drop the hips down. And you should feel kind of like a little pressure on either kind of groin, front, hip area. Feel that? Yeah. So here what you're doing is, again, you're rotating the hips externally, and then dropping the hip. And you're going to feel kind of a groin, not pain, but a strain. And that's kind of how you want it. You could also like bring the elbows downward even a little bit more under you, and that allows the hips to drop even more. So this is another way to get that anterior capsule. A lot of athletes don't know that, but their anterior capsules are tight because they're lacking that rotation. Phenomenal 1-2 combo between stretching hip flexors and the structure underneath it, which is the ligamentous component of the hip joint as well. So try that again. Same thing, you hold it for 15-20 seconds, ease off, come back on, and do that a few times. Try that out. Any questions, go onto our website and give us a shout. Thanks. See you next time.